One of the most important things that you should do is before you even talk to an instructor, you should talk to a medical professional. Tell them about all the conditions that you might have, get some blood work done, get a complete physical, and get cleared for the kind of movement you'd like to do.
Especially if you have recently, recovered from an injury or surgery, or, gone through PT as a separate thing, or having changes to your body weight or shape. This can be relevant also to transgender, gender diverse community. We have surgeries that might affect like our center of gravity, or things that might be contraindicated that we have to stay away from while we're healing from medical transition type things. All of that is important. Please also make sure you have a medical team that's actually listening to you. That's an important first step as well, because we are fitness instructors, but we're not medical professionals, and you should defer to what your doctor recommends or unrecommends within that.
By the way, all the doctors I've ever talked to recommend Pilates and yoga.
Absolutely. Yeah. We'll talk about that in another video, but there's so many benefits to it.
What are the benefits of just movement in general? Let's go over that.
Is relevant to a lot of people's experience coming through middle age and moving up into older adulthood. Teaching older adults is something that I have some experience and training with. A large segment at this point in time of my student base are also fellow middle-aged folks. Folks, on average between 40 and pretty much up to 70. It is so important. And this statement is credit of Christina Nakaya of Fit and Bendy. I first heard this thought from her, but it is so important as you age to continue to move through your full range of motion every single day, which is why folks who have really intensively continued to pursue, for example, dance movement or martial arts movement, like way into being older adults, sometimes they'll still be able to maintain that range of motion. It's not something that everyone can do, and you should manage your expectations around that. But that's part of why we have those practices to move through our full range. As folks age, it's common to experience hormonal changes, bone loss, muscle loss, often hormonally or not, issues related to sleep. And having movement practices can help with all of those things. It can help slow the process. Doing a certain series or of vinyasa or certain types of asanas in yoga physical practice can aid with sleep as well.
Absolutely. Aid with sleep. It can help you manage stress. All of it.